Arrhythmias are kind of intimidating. All the other major heart problems are structural. Heart failure is backup of fluid from stiff walls or weak pumping. Coronary disease is impaired blood supply. And valvular disease is tight or leaky valves. Arrhythmias are more abstract than this. Impaired heartbeat coordination doesn't quite simplify it as much, and it also doesn't capture the gist of it as well. Plus, arrhythmias hide behind the EKG, one of the most feared pieces of paper for a med student. One thing that took me a while to feel comfortable with was AV blocks. It's easy enough to memorize the description of the three types, but brute memorization only takes you so far. It was only after I realized that the problem was in the naming of it that I was able to get through this brick wall. The thing is, not all AV blocks are AV blocks. We're usually taught that a first-degree block is when the PR interval is greater than 200 milliseconds. A second-degree block has two kinds. The first, you get progressively larger PR intervals and eventually get a P wave without the QRS. And the second, you have regular PR intervals but occasional Ps without QRSs. And in third-degree block, there is complete dissociation between the P waves and the QRS complexes. While this is true, you could hardly come up with a way to make it more difficult to memorize. Much better would be if, instead, we just called them by what they were. First-degree AV block should be called AV delay. There's no block, there's just a delay in the transmission of the heartbeat from the atria to the ventricles. Second-degree AV block should be called intermittent AV block. In type 1, there is progressive AV delay until one atrial wave is blocked, and in type 2, the intermittent block happens suddenly. And third-degree AV block is a true AV block. Nothing passes from atria to ventricles, it's blocked. But because the term AV block in your mind is probably already contaminated by the other types of disorders above, you can also remember this by an even more descriptive name, AV dissociation, because the P waves and the QRS complexes are completely dissociated from one another. And you know by physiology that that's because there is a block. So let's see if this all checks out. First, there's just AV delay, then there's an intermittent block, type 1 with progressive delay, and type 2 with intermittent sudden blocks, and then there's a true AV block, or AV dissociation. Pause the video to see it on your own. Alright, so that's it. It's just much easier to memorize these nicknames than the lengthy definitions given before, which also makes it easier for you to remember and use the concepts in real life. I'm gonna leave this strip here for you to practice. There will be more videos on simplifying arrhythmias coming up, so stay tuned to learn more about these and other mysterious and intriguing topics that you wish were made more clear.